Commissioners Courtroom, 162 West 1st Street, Trinity County Courthouse, Groveton, Texas. And this week is orders. You want to take this?
Absolutely. You stand and bow your heads, please. Gracious Heavenly Father, we approach your throne this morning so thankful for the love and mercy that's extended to each and every one of us. Today we ask you to be with us, God, as we conduct the affairs of this county, that you would lead and guide us in integrity in every decision that is made. God, we thank you for blessing our nation, and we ask you to do these things in the name of Jesus. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one indivisible.
In the public forum, and it's on the helicopters. Mr. Lee?
Yes, sir.
You have 5 minutes.
I may pass it out. General Commissioner Brad Cover, y'all the tape, and we want to pass it down. So my name is Jared Lee. I represent HCA Airlife, one of the other air medical providers in the area. I know today one of the agenda items is to vote to renew the countywide membership. And in the past, we've received some questions from this community as well as others as far as billing practices in the air medical industry and the pros and the cons to memberships. So I represent a program that we don't carry a membership. And part of that is wanting to also help y'all understand the kind of the whys. So in early 2020 or 2021, there was a law passed called the No Surprises Act that outlawed the balance billing of patients. So a lot of the practices that we saw when patients were getting, you'd hear terrible stories of patients getting $20,000, $30,000 bills for a short helicopter trip to the hospital, causing undue financial burden to those patients. So with this No Surprises Act, the law has changed to where now any kind of dispute about the reimbursement for those flights is strictly between the air medical provider and the insurance carrier. So in these scenarios, the patients are only responsible for their typical out-of-pocket deductibles and copays. So the days of $20,000 bills and you've got to pay or else we're going to put a lien on your house, those stories are gone and have not been an issue for roughly 4 years now. The law was passed specifically to protect the patients from some of the predatory billing practices that we have unfortunately seen across the U.S. and across the industry. And so with that, with these new changes, the patients are very well protected. Air medical providers are going in network with insurance companies pretty regularly now. And any kind of dispute between what the insurance company is wanting to pay and what the air medical provider deems is necessary goes strictly between those two parties. The patient is left out in the middle of it. In there, you'll also see a map of kind of your local area air medical providers, where we all are. So the citizens here are lucky because you've got 3 air medical companies within comparable distance to one another to service both EMS and the hospitals. The biggest thing that we don't want to see with the memberships is this pressure to call just one air medical provider. That puts us in a situation to where EMS or hospital, that patient ultimately is waiting extended periods of time just to get that one service to them. In the event that the closest helicopter is not available, we work with EMS and other air medical providers in the area to make sure that we are getting to those patients as fast as possible and transporting them to the appropriate destination. The side of our helicopter says HCA on the side of it, but we will take patients to any facility that is needed. If they're established at a downtown facility, we'll absolutely take them there. We want to get to the patients and move them as safely and quickly as possible to their destination without causing the financial burden aspect. In the situations where patients don't have insurance, it's handled very similarly to if they were to go to one of our facilities, go to a hospital and not have insurance either. It's worked out between the hospital and those patients to settle on a payment plan or a dollar amount. And in a lot of situations, those bills are often written off from inability to pay. But again, the patients are not saddled with a big financial burden that they have to pay or else risk their credit scores or houses or any of those things. So that's all I had. Thank you.
So, I have a question. Are you just kind of explaining it, or are you trying to get the county to subscribe to the service you provide?
So my goal here today is really just to show you the other side of the coin. Knowing that the membership is a thing that the county has done the last couple of years. If the decision is made to not go with that membership, the patients and the citizens in the county are not going to be put in significant financial binds over their medical bills. And then the other piece of that is, again, not wanting to put our first responders or our hospitals in a position to where they're waiting extended periods for helicopters to get there just because of the membership part that they carry.
I understand.
Yeah.
I understand.
Yes, sir.
Thank you.
Thank you.
Another air service, and this is Rodney. And it's Brackham,
Was it Bradley?
Bradley.
Yes, sir. Good morning. Thank you for a few minutes of your time. My name is Brad Walker. I'm the Senior Program Director with AirEvac. I cover multiple bases across North, Central, and East Texas. But more important than that is I've been serving the citizens of Trinity County since pretty much 2010. Started off as a rookie, green, fresh little EMT, working a lot of shifts in Trinity. Continue that as a paramedic, and then again as a flight paramedic, and I'd like to think I continue that now in leadership.
You're with who?
AirEvac.
Okay.
So the reason I'm here today is first off, I'm not a salesman. I'm terrible at it. I don't enjoy it. I'm an operations guy. My world is pretty black and white. My focus is on the best things for the citizens, the best thing for our patients, continuing to evolve that care. And not only them, but the customers we serve. Those paramedics that got mentioned, waiting on a helicopter with a crashing patient, back their ambulance, with the rural facilities like y'all have here as well. What I wanted to share with you guys is, again, I'm an ops guy. It's all objective to me if I may pass this around. And I don't think I have quite enough copies for you guys, but what you'll see there is pretty much a simple chart of the distances to both Groveton and Trinity, your main two centers, and kind of the order of how soon they can get there. You'll also see a map that's very simplified. It just takes the two closest aircraft and shows where in the county they would be the quickest to respond. And the unfortunate truth, and I absolutely applaud the idea of memberships and y'all trying to do the absolute best thing for the members and the citizens of your county. Should be offered memberships as well, so I get it. The unfortunate downside is when it tends to, the paramedic, the physician, the nurses think they're doing the best thing. They're wanting to try to save some money, The unfortunate truth is when it's not the closest aircraft that shows up because their focus is financial, not patient care, it does not lead to good things. I said I'm not a salesman. If we're not the closest aircraft, don't call us. You know, I don't care what color you are, if you're orange or yellow or blue or red. What I wanted to do today is just share some information with you, kind of give you the opportunity to look back at the past couple of years. I can tell you PHI has almost exclusively been used, and you can see just based off of the raw data, almost exclusively they are the further aircraft. We have much closer options. So I just wanted to give you guys the tools today to help make an informed decision. I'm happy to answer any questions, happy to meet with you guys afterwards. I've got some cards in there as well. But that's it, just to share some information with you guys.
Thank you, sir.
Thank you.
Okay, Stephen McNeely.
Good morning. How's everybody doing this morning?
Thank you, sir.
This is a handout from Texas Right to Life, and it's just an update from the last time on the statistics that Texas, here in Texas, that we're having still, faced with the battle of abortions in Texas. And just an update on it to show that it still continues on. It's illegal, for physical abortions, but we still face the battle of abortion pills, and then people being taken to other states. And so just an update, again, Texas Right to Life. The last handout that I gave y'all the last time I was here was on the facilities for expecting mothers who need more assistance. And you can just put that with it. You still have that information. If you don't have more contacts for that, there are lots of people that just are wanting to help. And they're just, they have facilities, very good care facilities, and we want to keep this in the forefront of the citizens of Trinity County. And that, so I just want to make that aware to you guys. The pro-life argument is the intentional killing of an innocent human being is wrong. Abortion is the intentional killing of an innocent human being, therefore abortion is wrong. That's the pro-life argument. From that you get the other issues or things such as rape and incest. I don't have time to go into that in this forum. And then also my body, my choice. And so those are can be argued with on that. And so we want to keep that, and save the lives of the unborn. And so this is just information for you gentlemen. I want to thank you each and every one of you for this time, this forum. God bless each one of y'all. Please pray for the unborn, and please pray for peace in Israel. Thank you.
Thank you, sir.
Thank you.
Okay, number 4, approve the minutes, October 21st, 2024.
Your Honor, I didn't see any discrepancies in the minutes at all, so I'll move this adopted. Unless somebody else did.
Second.
All in favor?
Aye.
Number 5, discuss an act of approval on the subdivision plat for Dogwood Farm. Brandon? Y'all see this?
Good morning. This was a new subdivision over in the Apple Springs area. Close to the intersection of Highway 94 and 2262. It gets, its access, from Highway 94. It's a 4-lot subdivision. The access to the 2 easterly lots that do not abut Highway 94 will have access to an access easement. This will be deemed as a private road, so they're not trying to get any kind of county maintenance out of it. I understand a lot of this is going to change the way I've done this currently because of been in touch with Goodwin, Laster, and Strong, and they've made me aware that upon approval there will be new rules and standards, but they're working with me to make sure they don't put anything in there that we're not capable of under normal practices, and if there is anything, they're going to help us out, getting us, up to speed on what we need to do.
This is over at Apple Springs.
Yes, sir. It is right across from the Steel Horse, Wee Willie's liquor area right there.
Isn't that all low land?
Not really. Not really. Yeah, it's, I think the next major drain is probably a quarter mile, northeast of there.
What type of houses or whatever they plan on putting in there, do you know?
I do not know. I do not know. I know that the folks developing it, I believe, are going to go in, partnership possibly with a mobile home company as far as putting new mobile homes on the lots and have a partnership like that. One of the owner developers is a real estate agent out of Lufkin, Ashley Rodriguez, and that's what they're trying to figure out exactly if they're going to try to sell them as homes already on these lots or for new construction, either one.
Okay. Goes to the question for you. They want us to approve this property today?
Yes, sir.
We don't have our new subdivision rules and regulations approved yet.
Yeah, they're posted online, they're posted in the newspaper, and they have to be ran for 30 days or so, something like that. Lisa has it set for, I believe, the December 24th Commissioners Court for approval. And I think copies have been sent out to y'all, hard copies and email
Yes,
copies.
I got mine right.
Yeah. It's a bear to look at, so it's going to take a little bit, but right now we're running the clock for the notice posting. So right now we're governed by the older set of subdivision rules. And by the older set, this meets the standard, and Brad did everything he's supposed to. The old way says everything comes to my office, I look at it, and then I hand it to the judge to post on Commissioners Court. It's not a problem. With the new standard, it would be different than that, but that meets what's called for in the old standard.
What is that going to be different about it?
Oh, the road would be bonded and be a lot more with that.
There'll be elevation lines shown on the elevation delineation shown on the plat. There'll be, a lot of it is more to do with legalities than what I'm required to do.
It put a little more fail-safe in the maintenance of the road with the people. You'd have to kind of construct something, and I don't know off the top of my head what it calls for, but in the papers, it uses what's traditionally called for to ensure that the road maintenance is maintained and the people. I think the developer has to put up a bond for the road.
What is the consequences if we put this off till our is approved?
Well, so the thing with the new rules, they come into place and they govern once the property is subdivided. So if someone were to buy a piece of property now, and they would wait till January to subdivide it, and then it would be the new rules. But this has already been subdivided, so it wouldn't be right to say, hey, no, we're going to hold you to the standard of something that hasn't been adopted yet.
Okay.
Yeah.
Okay.
How do you feel about seeing the precinct?
I don't see a problem with it. If y'all need a motion, I'll make a motion to approve.
I'll add to double that it's not a very large subdivision, it's 4 lots.
Yeah.
It's off the main highway, so it doesn't look like water and sewer is gonna be an issue, or, you know, there's just an easement is the only thing, so you just be concerned with the road access. There's been other developers that kind of do the same thing. It's not the best situation for long-term use, but right now, it is sufficient for y'all to.
The easement part of the road is gonna be private, correct?
Yes, there's gonna be private, there's not gonna be any burden accepted by the county. Shows y'all second.
All in favor?
Aye.
So moved.
Thank you.
I have a question. How is the subdivision name decided?
The developers, owners chose.
So they just picked a name?
Mhm.
And then
They ran through to make sure it wasn't a conflict on previously recorded subdivision.
okay, good.
So,
And the name of the road, when will they decide that?
I'll have to get back with you on that.
Because I have to draw it on the
Right,
map
right, I got you.
to address the
I got you.
lots.
So with the new stuff, they go through Disney prior to, it's just, we sent some stuff back for him to change, there's some time, we didn't change back on the other stuff, and now we have to wait an allotted amount of days. And people, you give them a chance to contest it and things like that.
Right. I understand that we've got some more activity coming our way.
Yes, sir. No, it's gonna happen as soon as possible, it's set, we just have to wait to stand.
No, I'm talking about other subdivisions.
Yes, sir. No, that's.
It's,
Yes. And we need to have these rules in place so that we don't have some of the places that we have now.
the standard has been changing on Polk County, Houston County, Walker County, Angelina County has been pretty more established over the years, but I'm starting to see it more and more in the surrounding counties, what we're required to do. And I think it's a good thing going through, somebody like Vision Master Strong has experience with this, like in Tyler County and Angelina County, you know, with managing this type of deal. Any other questions? Thank you.
Thank you.
Thank you, Brad.
Number 6, discuss an act of PHI membership agreement for Trinity County. Morning.
Good morning. All right, I'd like to respond to a couple of things I've heard so far this morning. No surprise billing, best legislation ever, in my opinion. According to multiple online sources, Data USA and Texas Health Services Commission, roughly 19% of Trinity County residents are uninsured. So 19% of the population will benefit from membership regardless of no surprise billing. Our Lufkin office, our Conroe office have both serviced Trinity County fairly well. I haven't heard complaints about delayed flights or anything like that. I haven't heard that your EMS services are calling helicopters that are farther away and risking any patients' lives. I've heard really good things about their judgment calls and that sort of thing. You might know something I don't, but I haven't heard any negativity regarding that. You've basically saved, you've had 39 flights covered since your agreement started at the beginning of this year. That's 39 people in the county who didn't have to worry about the medical bill. Some hospitals may be willing to write off indigent care. I don't have those types of statistics, but I know they all don't. I talk to people all day, every day, and I hear the stories of the bills of their $10,000 deductibles, $20,000 deductibles, their maximum out of pocket, or their uninsured household members. Your membership takes care of all of that. It's not exactly possible to take care of every single person in every community. Luckily, we have freedom to choose our health care without government interference. That makes it impossible to cover every single person without extreme expense. Your membership can take care of as many as possible, well, without sacrificing their quality of care or the speed of their care. And without worrying about whether or not they're gonna fight with hospitals for bills or anything like that. It's been a good plan. It's been very functional. I haven't heard any complaints from people about quality of care going down because of it.
Out of the 39 flights that we've had this year, have you heard of any, or have y'all billed any Trinity County resident for any of those 39 flights?
Those 39 flights were fully covered by the membership. Those were verified flights that were covered and paid for by the membership.
So the only thing that I see is different is the gentleman earlier said that, I guess there's a law passed that there's no more than 20, 30, 40,000 dollar flights. You're basically, the Trinity County resident would just be for, or have to pay for their deductible if they have insurance and stuff like that, correct? But with your plan, and I, excuse me, and I said this, I asked the same question 20 years ago. PHI, if we go with this plan, it covers that deductible,
It
correct?
does. Any portion of your deductible or out-of-pocket maximum or anything like that that is applied to the helicopter bill is taken care of, no matter how high it is.
Just a couple more if you don't mind. I also asked a question about if we got two EMS in this county, one is here and there wouldn't be ever an issue, and I'm with everybody here, I think it's an agreement where the EMS we got, or the fire department, or the sheriff's department, or police are gonna call first, whichever one get here first to help Jane Doe
Right.
into the hospital. There is no issue, there's no clause in here. Colton went over this a couple years ago that they can call, if somebody's closer, they call in, correct?
There's no legal restriction on who anyone has to call. Everybody hopes for the closest helicopter in the event of emergency.
Well, I think I haven't had, me personally, had any complaints about our two that we have now, EMS. And you would think there'd be some kind of complaint we would get if there was a closer helicopter. If it was me out there on the side of the road, if there was a closer one and the further one was free, I would definitely want the closer one for me and my family.
Right.
And I would pay for it no matter what. It's what I'm getting at with that, so.
Right.
That's all, that's the question I have.
How many of those 39 didn't have insurance?
They, I couldn't get that data, but if we extrapolate from the statistics of overall, you can expect about 19% to have been uninsured. If the statistics hold up.
10 or so, probably.
So, we've been under contract with y'all for 2 years, am I right?
This is gonna be, if we approve this, we the third, full, going forward.
But if I'm right, Miss Bonnie, we got a grant that covered it for 2 years.
Yes, there's enough money to set aside for a third year, but again, this is a year-to-year contract, so that's entirely up to the court as to whether or not you're going to extend that contract. It's just because we set aside money for air medical out of that grant, it can be reallocated. That's entirely up to the court. It's not earmarked.
But I thought there was enough money in there for two years,
There's enough money for free.
for 3. Okay.
The original deal was 2 years, it was 2 years for, remember we paid out animal control. There was
Right.
one grant, there was animal control for 2 years and air for 2 years. And I had that question as well about, is there enough money in there, or where would we get, you know? Because it was under our impression that it was 2 years.
Yeah, I asked that question this morning for them, and I thought it was 2 years too. I asked-
And again, the money is there, but the contract is a year-to-year basis, so the contract decision is up to the court.
Well, I brought this same question up last year, and I'm gonna bring it up the next year, because I don't understand what the advantage is for you to have our membership. When I talk to the ambulance people, when we put fire band on, I talk to the fire chiefs. When we talk about medical, I talk to the ambulance drivers. I talked to the insurer in Trinity, and I asked him, I said, tell me about PHI. He said, there's a company. I said, so do you use them all the time? And he says, I use them, but he said, I have about 6 different companies that I call. He said, if PHI is 45 minutes out, and I can get somebody else that's 20 minutes out, that's who I'm gonna use. So what is the advantage of us having a secluded deal? Well, it's not secluded, but a membership with y'all.
So the advantage is the ones who do use us wouldn't have to worry about the expense whatsoever. If you could afford to buy a membership from every company out there, then nobody would have to worry about it.
Well, all the 39 people that she's talking about, to their advantage, they're gonna go after the insurance money. It's not gonna, all the 39 people, let's say the whole 39 people had insurance, they would not have to pay anything. They would just go after their insurance and get the money. That's their advantage.
But you're saying these other 2 gentlemen over here, their companies will go after the individual? Is that right?
No, sir.
We do membership as well.
So if they're uninsured, how does that work?
So in our case, for instance, you go to any hospital and there's the opportunity for folks to show up there without insurance as well or underinsured. And those are always case by case situations where they work out a plan. Not everyone is written off. No, absolutely not. Some people say I can pay $100 a month, and so they'll say, okay, we'll pay $100 a month until you need this much, and then your bill is settled. And so, knowing that not everyone's going to get written off, but there are payment plans made for those individuals, and typically what we're seeing from our side is our average out of pocket that our patients are paying after being flown is around $500. So there's again not the $10,000 bills. The patients are being forced to pay or else.
That's if they have insurance or not. That's what you're. Like say if I don't have insurance and I get flown, and you're saying that the majority of people that have insurance is only has to pay their deductible. That they put the laws in place for that. What if I don't have insurance? Where does that limit for the person with no insurance? Or how?
The finer points of the process, they get flown. The first thing the patient gets in the mail or patient's family is not, hey, you owe us this much money. It's, this is your patient billing advocate, please give them a call. And so they make contact with the billing department and they start asking what resources they have. If they have insurance, sometimes the insurance just takes one look at it and says, no, I'm not covering something. So they'll help them through any kind of disputes. And then once the insurance says this is the final amount I'm going to pay you, any further dispute is only between the paramedic provider and the insurance company. So the individual at that point is taken out. If you're uninsured, the same type of conversation starts with what resources do you have? You say, I don't have anything. I don't have insurance, but they'll start working through, okay, well, do you have the means to make payments? So what does your income look like? If they don't have income or it's not steady, that's when they start to take into consideration looking at other avenues and or writing the costs off completely.
Well, I can tell you firsthand that the day that I got to the hospital, my daughter was in that wreck. I got done on the spot for $58,000. Right then there in the hallway, and I hadn't even got to see my child yet. And I mean, the helicopter service was pushing it. To finally, a caseworker from the hospital got them off me so I could see my child. So, how in the world? I mean, everybody's got to, do you face that when you get to the hospital? Do you start to go toward the patient and go, hey, you need to pay right now?
No, sir.
Okay. With somebody not insured or insured, payment plans is what you're saying that they do.
Correct. Yes, sir.
So I wouldn't give it
but not for but just to be clear too, it's not necessarily if they decide the difference that the patient should owe is $10,000. They're not always going to make that patient pay the full balance. They're gonna find a happy medium that both people can make happen. It may be $5,000, it may be lower than that. But no, especially our team, whenever we show up, none of the 3 providers are going to those patients asking about financial needs.
The one that day, if it hadn't been for the caseworker, we would have some difficulty in the hallway because they were just demanding payment on the spot.
Was this prior to 2020 or no?
Yeah, it's prior. Yeah.
So can I ask one more question? I know only on the helicopter, is it a difference in payment for the money up front? Are y'all cheaper or higher or same
I'm sure there's gonna be some variances between the 3 services. I can't speak to how much or what that looks like between all 3.
And sort of clarify as well too, and it, there are advantages and disadvantages of memberships. I mentioned earlier, for example, our company as well, those 2 memberships. And that's a whole nother discussion to clarify because you do have options, but also to clarify, as I understand it, your contract with PHI is not an exclusive contract. It sounds great to say, yes, the provider still has a choice, which they should. You all mentioned earlier, I don't care if I need a helicopter, if it's that bad, just send me the closest one. What I can tell you is, unless those 39 flights that she mentioned earlier all came from Apple Springs, the closest aircraft was not utilized for most of those because the Crockett aircraft would be the closest. It's about 13, 14-minute flight time. There's a little bit more to it than that, but to Trinity. But I can't tell you the last time we flew one out of Trinity County at all. So unless those 39 all came from that in your map, that one little yellow area, that's unfortunately not the decision that's actually being made in the facility and on the scene.
So it took one.
It is a further distance, yes, sir.
Is that correct?
Crockett is a little closer.
Yeah.
It is a little closer.
I believe the map there that I've shared has the businesses between the Crockett location, our Groveton location, as well as the PHI Congo location, because you're pretty close to helicopters to this area. And it's got the differences in the distance listed out on there, with Crockett being the closest.
So, let me ask you a question. All 3 of y'all. Who makes the phone call? Is it the ambulance personnel that calls the sheriff's department to make the dispatch, to make the call? Or is it the ambulance people call from right there on the scene?
I'm sorry, go ahead.
Every county has their own protocol for how their dispatches
That's kind of what I
work.
figured.
And as far as I know, in this county, it is the dispatcher that makes that call, right? And so your first responders will notify dispatch of the situation, and dispatch will make the phone call. We have 2 helicopters that service the county, as you know, Conroe and Lufkin both. You guys have a helicopter there in Groveton. So the county's well served. If there had been complaints or anything like that, things might be a little different, but I haven't heard of any complaints or any problems related to any of that. You just have the opportunity to save a significant portion of the people who are flown from the county or it got a bill. Everybody's had a declined insurance payment to get to the hospital. Great news, you're fine. Insurance will, what am I gonna pay? It happens, it does. Things may be a little better with the no surprise billing, no balance billing, whichever way you want to call it. But people still experience bills, they do. And this is an opportunity to save a significant portion of those people a significant bill. Whether it's just, and I talk to businesses all day, every day. I talk to insurance brokers at the business as we provide their employee benefits. One insurance company, their broker will tell us almost all the claims are declined. They're not going to pay the helicopter bill no matter what. They find some way out of it. And the next one will say, we're going to cover all of them. Nobody ever has a declined claim. Insurance is different for everyone. Everyone has a different deductible, different out-of-pocket maximum, different level of service from your actual insurance company, but you still got 19% of your population who doesn't have insurance at all.
My question now, how much is renewal? Let's talk money.
Do you wanna wait though and see what theirs are before you start speaking?
If they would like to do that.
Do we need to take bids?
So
Are y'all prepared to have a,
I'll start and just tell the group, my program does not offer memberships. We will come, we'll pick up the patients, take them to where they need to go, and then we go through the billing process that I had described.
And you're the one out of Crockett.
Yes, sir. So
You're out of where?
Livingston, sir.
Livingston.
So that was, the big thing is, I'm not the closest provider here. But my ask is that, similar to Harry back, I don't recall the last time that we've done a flight out of this county being the second closest helicopter to Ethan. So, wanting to make sure that there's not perceived real pressure to utilize based solely off the membership.
The question was, are you prepared to put a bid in?
Area that could, if you are wanting memberships, we are happy to. I'll get back to, I'm not a salesman, this is not my world. You know, PHI has 2 aircraft in the area that would be covered by that membership. On that chart that y'all have, look at all the blue, that's what would be covered by ours. But we would absolutely, if asked, provide a bid.
We do have other helicopters. Those are just the 2 closest.
Y'all done a fine job.
I think it's really 2 questions the court needs to consider. One, do you want a service, you know, that y'all choose to pay some money to provide the service to the county residents? And if you do want that, you know, do you want them to go out for bids? I think the plus is that probably, 19% or so, are going to be free from paying a bill since they don't have insurance. Now, the benefit to the helicopter company is that whatever payment the county pays them kind of covers that loss for them that they weren't going to get before. Since I don't know what the statistics are, but I generally would think that a lot of those non-insured people, those medical bills go unpaid, and the business would probably have to eat them.
yes.
Now, the detriment to having that service provided is that naturally the county, who dispatches the, helicopters, tend to lean towards the one that there is the agreement with. And I think what these guys are saying is that sometimes they might lean a little too hard, and minutes might be lost because they're going towards the one that we have agreement with. You have to think, is the money, worth, that trade-off? It's kind of a complex question, but I think that's what they're saying, and they're saying that nowadays with the, no surprise, that the money isn't as big, or I guess, it's not as big as a problem as one might assume a helicopter ride would be since that legislation was passed.
Me personally, and I know y'all got to say there, but PHI is really getting to the service. And not that you had to either,
I just like for everybody to be on the same playing field. And I'm still not convinced that giving them $42,000 a year is doing all this for these poor people in our county. I'm not convinced of that, but we all got our opinions, so let chip fall where they may.
I can say that amount is generally speaking less than the average price of a flight.
That's my main point. $42,000, and y'all charge more than that for one flight. So it was brought up over here that maybe some of this insurance don't pay, and y'all take that as part of the payment. Don't make no sense to me. That's money. That's figures.
Which part, can I help clarify on any of that? I'm not exactly sure I understand the confusion.
Well, A flight, on the average, what does a flight cost? I know they're different, but an average.
Well, I don't have averages, but I do ask a lot of people if they know how, have you known anyone who's flown, how the bill turned out? And I do hear a lot of people in this region telling me 60, 65,000 as a run across people. And that's not, for one helicopter company, that's just the most common answers I hear throughout East Texas.
Let's just take that figure, 65,000. You get beat out of one, you're 42's gone. So what?
The benefit to
It
the
don't
company.
make no sense to me.
It's a community service.
They're more likely to get caught. That's the benefit. Right, that's the benefit, is the top of the list. Like, that's why they're doing it. I mean, I was kind of against this in the beginning, but you hear people in the community and they really like this service. It makes them feel good. It's something we can do, and generally speaking, not that expensive, that insulates, county residents. That being said, Crockett is very close, and that being said, if we have someone else open to it, then maybe we should, go back and have them resubmit bids like we do with everything and treat this, like it's county business. We have two companies wanting to do it. And PHI just kind of got here first when we were in pinch with the ambulance service in Groveton. I think that was the catalyst that really brought this on.
You're right.
So now that we have the ambulance in Groveton, maybe we should do it right and kind of shop around and kind of let the free market give the residents the best bang for the buck.
Yeah, I have agreed with Colton.
What's the time frame you got? First year?
Is it first year, Mike?
I think that's a good idea. I'll make that form of motion. We'll table it and let everybody bid for it.
A second. All in favor?
Get a bid.
All right, yes, sir.
Get a bid.
Discuss an act on the National Workers Grant Program. Priscilla Stewart. Morning.
Morning.
How are you?
Good. Just to clarify, my first name is Patricia Stewart.
No.
I'm with the Groveton Workforce Office out of Groveton. So I know that the floods and the hurricane happened a while back. That's okay, we have this grant until next year, and it could be prolonged, depending on how long it's gonna take to help, fix the roads or do the cleanup, due to the destruction that happened. Now, I will let you know, it's only for those that have been unemployed for up to 27 weeks, or more, just depending.
Say that again.
If they've been unemployed for 27 weeks or more. So they are limited to working 12 months or 2,080 hours. So it just depends what they reach first. If they reach a year first, what's a year? If they reach the hour limit of 2080, then that'll be the end of the program for that person. They will all be required to do the OSHA 10 construction. The only way for them to apply right now, at the bottom of each, it has two people listed. They have Misty and they have Nikisha. Now, Nikisha is for this area here. If that person is interested and they want to call her and kind of get the paperwork submitted and kind of get that process started, they would need to reach out to her directly. Now, I will tell you, I have been passing out flyers, and from my understanding, there was one person approved from Apple Springs. I'm not sure if they started yet or who they're working under, but that's the latest that I've seen. I will continue to pass out flyers around the area, hopefully kind of drum up some of that. I know we have a lot of people that are unemployed, so hopefully this will kind of help them get back out there. And then at the end of the program, if y'all do decide to hire them on, you do have that option. Y'all have any questions?
Okay, thank you.
Thank you.
motion, need a motion.
So moved.
Second.
All in favor? All right, discuss an act authorizing payment to Martin Senior Citizen Center and Home Delivery Meals.
If I understand this right, we do this in February usually,
Yes, or we paid out earlier if need be, we do have an amount that we send
that
to.
they're requesting it.
They need it for a grant.
So move.
Second.
All in favor?
Aye. Judge, why don't we take this a little break?
Okay.
You'll get over it.
Oh, you're awesome. Hey, you're awesome.
It's not, it's, no, it's in for services. And I'll just get their name off what they give you, and
Number 9, discuss an act of official bond.
Got 5 of them, they're all JP clerks and tax office. I make a motion to approve. Renewal. Yeah.
Second. All in favor? Aye. So moved.
We don't have any funerals.
No funeral. 11, discuss an act on personal action form.
Make a motion to approve.
Second.
All in favor?
Aye.
So moved.
Is the one from these people? Good morning.
Morning, how are you?
Fine.
Discuss an act on complete check register.
You have the complete claim register that I'm calling it, because that's how it prints out on the new software. I hope you like this a little better format. It gives you the department. It gives you the description. It gives you the vendor that was paid, or in this case, since all the payroll is now going into your department line items, those are basically coming up through the system for us to approve. So when we issue even to the IRS, your payroll taxes, we're paying that through accounts payable. So that's why you're now going to see this on your claim register. So at the top, you'll see mostly your salaries that occurred during the month of October,
This is only for the month.
only for the month. But this gives you a real good idea of how much total each department is for payroll and expenses.
I looked at it, studied it last night, and I kinda like it.
I've been tweaking any possible way I can to get just down to the main information, what you need to know.
Yeah, looks good.
I like it, I do.
Okay, good. Because if you look down at the bottom, it says selection criteria with, and you see all this long string of numbers. That's what I have to do to build that report. But I got it saved, it's good.
Hmm.
It really looked good.
It does, I like it.
And at the back of the report, I've run separate reports that will give you your vendor claims, how much we're actually paid to the vendors for the month of October, and how much total. Which is, you can see how much has gone from Road and Bridge for your department, and then you'll also see all of the vendors on the back 3 pages.
Nobody has any question, I make a motion to approve.
A second. All in favor?
Is that for,
Aye.
both item 12 and 13?
No,
That's
just
for
12.
Wednesday.
Just 12.
13, discuss an act approval of claims or invoices for disaster-related purchases.
Now, this covers 2 weeks from October 21st through November 7th, the last time we ran the report. These are the ones that we've paid so far, just in the last 2 weeks.
I'll make a motion to approve.
Second.
All in favor?
Miss Bonnie, too, what I asked you for earlier.
Yes, sir.
That's on the report. And I apparently hadn't sent in the other,
You're looking for some additional ones? Okay.
yes, ma'am, because it's 6160.
Okay,
It's what that rock total is so far, and that's what they're going for in that disaster center.
yes, and we keep a record.
Okay,
All of that is
Yes, ma'am.
coded,
okay.
and then Miss Vicki
Yes, ma'am, I want Miss
gets
Vicki
all
to
that
have that
information,
too.
and we
Yes,
send
ma'am.
it straight up, so.
Well, thank you so much, Ms. Bonnie, for your help. I really enjoyed the report, it was good.
All right, good, thank you.
Yes, ma'am.
Okay, number 12, we need to go back and do all y'all.
We got a motion by Tommy, and a second by Stephen. All in favor?
All in favor?
Aye.
So moved.
So there we got the check.
So number 13, I did that, right?
Yes.
We're on number 13.
So moved.
We already did 13.
We did 13.
Voted on 13.
Okay, we did. Well, let's go on to 14.
Who did the,
Okay, I made a motion on 13.
yeah, no, second.
We got a check.
Okay, on this engineering invoice professional service on subdivision regulation.
You had an agreed upon amount. That amount was paid, but I went ahead and put it to contingency, but I do need the court's blessing on that. Pay it from reserve, because we did not budget
How much?
your subdivision,
Yeah, I know.
8,000.
8,000, so moved.
Second.
All in favor? Okay, number 15, discuss approval of issuing a county cell phone to the Veterans Office.
I kind of jumped the gun on that one too. I went ahead and got her a cell phone because she was already receiving phone calls from veterans. But I, again, just want you to know that there is a county cell phone for the new veteran officer.
So that's gonna be her only cell phone?
Yes.
We're not gonna have a land phone?
Well, we've got a land phone at both locations,
Yes.
just
but-
anyway, yeah.
But her location's gonna be moved.
Yes, and this one up here is just wired, so there's no cost here. The only one that we would, if you want it disconnected, would be the Trinity office. If you don't want them to dial into that, but just use her cell phone. Or we can transfer it so it'll roll to her cell phone,
She's getting calls for it.
Is she?
But I'll just take the other phone.
because they're going to that main number, so she really needs them there in order for it to roll to her cell phone, no matter where she's at.
Okay.
If it's not there, it won't roll.
It- We can preset them so they'll roll.
I'm saying if
Are we
there's
still
a phone,
waiting on
there's no
that?
service.
So at
there.
least, oh yes, absolutely, so if somebody needs to make a call while they're in there with her, they can use that
You said
landline.
got it moved yet.
But the attorney has to look at it. We're gonna come up with a,
Our attorney?
$1 a year, please.
I don't know, maybe about 20 years.
I didn't get the specifics on that, but it's $1.
I make a motion to approve the cell phone.
I'll second it, Sam. That's the money.
All the record, I abstain on this.
It's a reasonable cost for a cell phone per month. It is.
All in favor?
Abstain.
Okay, discuss an approval of declaring surplus salvage items.
Wait, before you do it, I need to check if there's anything.
Yeah, I looked over it real good last night. I don't see anything there.
Mostly all.
Y'all hurry up, make the motion, or I
I'll make a motion to approve.
Go ahead, Neil. Second.
ain't.
All in favor? So moved. Number 17, receive auditor's fourth quarter report for September 30th, 2024.
This is for your information only. It wasn't all good news. Just
So-
to bring you up to date, and we've had some hiccups along the way. but we're working through them. So, any questions?
What is the penalty for not turning in the report?
Reprimanded by the court.
This
Now,
is
if they
just,
fraudulently, if they refuse to turn a report in, which that's not what's happening, there is a legal penalty. There's a fine, $25.
we ought to have the bugs worked out of the system.
It's not the system's problem.
I understand it's the employees and
Yes, we have a
and
situation.
department heads, and it needs to be addressed, and Judge, you're the judge. So it's your ball.
This is how I alert you that we have some issues. We're working with the department heads and the staff
What,
to clean this up.
can you fill me in on what?
Oh, do you get my quarterly report?
I don't, I mean,
I'll get with you after.
Our monthly, every fee collecting office is required to turn in their monthly report to the treasurer and the auditor's office
uh-huh.
within a reasonable amount of time. Now, we give them 2 weeks, usually up to the
Sure.
15th of the month, as soon as the prior month closes, because we have to receipt in what they received. But if we get it late, we're rushing around trying to enter it into the system for me to get you your monthly report and your bank account balances, so you know what really is, what's happened for that prior month. So, there's just been a breakdown, and there's been but this conversion actually brought it more to light and made us really say, we gotta get on top of this now. So, this is the warning shot.
Okay.
Okay, that's all it
I
is.
just making sure county attorney knows it.
Yeah. You're okay. And that's really all it is for your information. Again, if you want more detail, come speak to me about it. Okay? Thank you.
Thank you, Ms. Bond.
Number 18, discuss and act on approval of maintenance service agreement for preventative maintenance on county generator.
I think I would think that table this for us because one of them didn't say it's for yearly versus every time it comes out.
And there's a corrected page on that. They were contacted and they corrected that. It is a yearly
It's
cost.
a yearly fee.
Yes.
3,050. Would they have it? Left. Fair. And WA.
So one of them, all around is around, what, 8,000?
A little over 8,000.
A little over 8,000, and then, for ours, it's 16,800. And WA is 12,600.
That's correct.
And the scope of work is the same on all of us. Well, then I think we ought to get the best bang for the buck. I move to go with all right. Yeah, all around. Got a second right here.
All in favor? Aye.
And that was for all around?
Okay, number 19, discuss approval on pre-approval to act for remaining funds on GLO Texas General Land Office Disaster Recovery Relocation Program for emergency communications equipment for Trinity County.
They contacted Trinity County about they call it the DRRP program. They've taken from 2008 to 2019 all of the FEMA grants that have not been zeroed out, and combining all of the money together and going to reallocate it. And it's for certain counties that can apply, and Trinity County is one of them, and it's only for 4 or 5 different areas. The one area that they contacted Trinity County about is radio equipment. And they said that our volunteer fire department and our city police department in Trinity and our county police department need new radios in their vehicle, not their personal vehicles, in the vehicle that's owned by the fire department, to be able to communicate back and forth. They also said that the dispatch system that Trinity County has needs to be upgraded. It hasn't been upgraded in several years. So they, Mike called and we discussed it. You have to pre-apply to request the funds. You have to tell them what you want it for, how much you want, and where it's going to be spent. We're looking at 65 to 70 radios, permanent radios in a vehicle for the volunteer fire departments and the sheriff's department and for the city, yes.
So you've got with all the fire
Yes, sir.
departments?
They all came the other day.
All 6?
Mm-hmm. And
Okay.
I have their little list, they put their name on here and what they needed.
And
what
the
they
sheriff's department?
owned. I haven't seen the sheriff's department,
What
except,
about the police department?
Mr. Carroll has been working with the sheriff's departments getting the information together. We have until the 21st of November to put in an application. Doesn't mean that we will have the opportunity to apply, it just means, hey, we're interested. And February is when they come back and say, okay, now we see a need and you can apply.
What about the city police department? Have you
Yeah,
contacted?
Trinity. I have not spoken to them, but I think Mr. Carroll has. But before I went any further, I wanted to see if it's something y'all are going to want to do.
Sure.
It has to be a county, it can't be an individual entity, and it has to include everybody in it. So I can call the city and ask them what they're needing. Like I said, it has to be a permanent, and I do have a list, and I want to say Trinity is on here.
I won't make a motion when we go ahead and approve this,
Yes,
but I want you to make sure that
I will.
you get all 6 fire departments,
Yes.
the county,
yes.
and the constable's office,
Mhm.
and the city of Trinity.
Yeah,
And I'd like you
City of Groveton.
to call and make sure it's been taken care of.
yeah.
Yeah,
I've talked to several,
Yeah.
well, the volunteer fire department, several
Even
here.
if
the
somebody
other
else
day.
has got it, just check,
Yeah.
make sure
Okay.
somebody.
I don't know who to tell you to contact in Trinity.
The Trinity
You got a
Volunteer
second?
Fire Department,
Yeah,
that's the chief.
second.
Yeah,
City
but-
police.
City
All in
police.
favor?
Oh,
You got,
You got a second?
oh, he seconded that.
Okay, okay.
All in favor?
all in favor?
Aye.
Like I said, it's not even a guarantee that it'll be able.
With the city police and Trinity,
Want to know who to
I would make sure, and this is for getting radios for them, is that what it is?
Well, your eyes.
This is for getting radios for people?
Yes, radio, huh?
So right now, they're in a transitional period. I would see about requesting the amount of radios for spots that they normally
Yes, the
employ.
vehicle and the dislocated.
Even the ones that aren't filled right now because you're going through a transitional period. We don't want
You're right.
everything to get fixed and then they're short 4 radios or something like that.
That's a good idea.
Yes. Yes.
Yeah, we don't be short after we go and have.
It's it's quite a few
They got 2
radios.
vehicles here, might as well add 2 to the count, because I don't know if they're ever gonna bring up the new police department or not ever, but they still have 2
Units over here.
Two units.
Yeah, that's what
And
he
two for
put
the
down.
city of
That's what
Groveton,
he's
just
talking
because
about.
again,
They don't need
what
two
made
there.
it.
They got 2 units.
Whatever you do, don't let Mark, Jones have much to do with it, because he'll spend the whole $65,000 on his own.
My God. They will.
You deserve that.
Who's your commissioner?
The man spent $8,000 on lights.
He
I want
needed
to see him flash.
Are you gonna take it to the Christmas parade? Get ready for that.
Look everywhere.
All right, Judge, let's move on.
Okay, number 20, discuss an act of approval on a request proposal for grant administrator for round 3 with wildfire defense grant.
Okay. We were approved for the round 2. And as everybody saw, we got $250,000 to write our plan. In the meeting that day, they said there was a caveat that even though our plan isn't ready, if we have a mitigation plan that is current, sometimes they will accept that and let us apply for round 3. Round 3 will open within the next 2 weeks. Once it opens, I would like to be considered for us to apply for that. That's for when we're looking for the heavy equipment to help with all of the fire departments and the, yes. Now,
Can you be this person?
No.
No. Who we
We
gotta
are gonna
be?
have to go out for a request, for a proposal, and that's why I'm coming to you, because once it opens, I wanna get all the paperwork ready and come back and show you then, hey, this is what we're gonna do. But I want you to know, we've been approved. They said, hey, you can apply for round 2. Round 1 was not offered to Texas. We were offered round 2 and we got it, and now round 3. And this is supposedly the final round of this money. So, since they said, hey, you can apply, I would like for us to be considered.
The grant requires that we go out with bids. That's
Yes.
why we're kind of stuck on this one.
So move.
Second. All in favor?
Aye.
So,
Miss Vicky,
Thank you, Miss Vicki.
one more time. You're doing an awesome job.
Yes, you are.
Employee of the Year award. She never asks for money, she always gets it. You know that's a difference in her and the rest of
We're
them?
keeping track.
Huh?
saving it up.
I'm keeping track.
She said she left precinct 1 had all the favors.
I'm sure she did.
I can ask for the play.
I'm sure so.
But she don't ask for it, I can ask for her.
We've been getting behind kid for years.
we might sell that bobcat.
Yeah, we will. Put that on that surplus list again.
Number 21, discuss an act setting a public hearing on the petition closed Latham Road, Alice Springs, Texas. That's down in your agenda. Yes, sir.
My name is April Lamb, I live on.
Now I can't hear you, baby.
Sorry. My name is April Lamb, I live on Landrum Road. I'm here today to try to turn this into a private driveway. As we stand, I have people constantly coming down my road and turning onto my private property and having to turn back around and leave. We're the only home on this, county road. We would like to self-maintain, stop people from coming down our road. I have a survey here that shows that the county road stops right behind my house.
And this is in precinct 4?
Yes, sir.
So, ma'am, how long is this road?
It actually stops right where it says gravel road. I have pictures.
Where are you talking about?
What are you?
The green in green.
Okay.
It literally turns into
It
my,
actually goes on to the next property there.
So is there, that was my next question, is there anybody else got property down there?
no, sir.
Really?
This is
I think there is.
the survey marker at the end of my property.
Yes, ma'am.
It is overgrown, not maintained. I was told that that was the end of Landrum Road,
Yes,
but there's no
ma'am.
access for anything. It has been washed out. It's eroding from the rain coming off of the other property beside me.
We've all got them roads
Yes,
in
sir. Yes,
our
sir.
precinct.
Yes,
It's
ma'am.
washed out, we had to fix them because there's not a need. But if there is a need, we'll fix them for the people to get to them, but yes, ma'am.
Is there another landowner's property that abuts that county road?
The people that live next to us, the cow pasture, Max Dewey, he has property on right
Lewis.
beside me and behind me, but he has separate access to access.
So there is another piece of property that abuts that road.
There is, but it's also right next to me, so it kind of goes
Who are all
around.
these people signing the petition?
This is.
People from the senior citizens home and Berkshire,
What do they have to do with that? With that,
they don't have anything, it was a petition to help close the road.
but I'm saying they don't have any interest in the road at all.
And they use this road right here?
Tommy, same thing they do when they close McMullen.
It needs to be.
Anybody in the precinct,
Anybody can.
anybody in the precinct can sign the
Yeah,
petition.
paid people.
So is this the road right here?
That's the road, yeah.
However, I think the important part is that there is another landowner who owns property that abuts that road. And I think he's here today, and from what I understand, he's against the closing of the road.
There's actually two landowners. It's Mr. Woolsey has land that touches the road, and it has Lee Do at the end. And they didn't sign this petition, and that's one of my requirements to close the road, is to all landowners that are affected to have to sign this petition. So I have no interest in closing the road until those two sign a petition.
At the bottom of that petition, it also states primary residence. We are the only primary residence. So with that being said, we didn't feel the need to contact them. They do not live there. They have access to their property from their homes.
Well, did y'all just buy this place?
Yes, sir, we did.
When?
The end of June,
Y'all from around here, are you?
Cleveland.
Cleveland, yes, ma'am. Well, we want to welcome you to Trinity County, but that road ain't gonna be closed, I just tell you right now. So we go on with this as long as you want to, but.
It can't be accessed though. I mean, there's a washout at the back of
I
it
told
where
you,
it states it's a
They can
county
fix the
road.
washout.
This is a road that doesn't get traveled a lot, but it's there in case.
If you're gonna say
It used to go on through, it got closed in the past, that's when people quit driving it, that's when the maintenance kind of slowed down on it. I'm aware of the washout, and if it has to be fixed, I'm gonna fix it, but Lee Do uses the road to access the other end of his property. He has timber in there, and that's the way it has to come out.
He has a road coming out by his house. Why would he have to disturb our house when he has a home
Well,
connected
that's
to
just
the
the way it is, if
property?
you live on a county road, that's just what you have to deal with. But I make a motion that we don't set this, public hearing.
John, I'll second the motion.
All in favor?
Aye.
So moved. Number 22, discuss an act on surplus material allocation for fiscal year 2025. Textile.
Judge, I had this, you put on the agenda, we do this every year. Mr. Wars up there at TxDOT in Groveton called me and said they haven't received our application or our approval yet, so I had it put on the agenda, and, the material, I'm assuming, I won't wrap, I don't know what y'all.
Yeah, we will.
The materials here in Groveton, and we can, as soon as this gets approved with us, y'all can send it back today, and we can start hauling whenever.
Do you have an idea how many loads this time?
It's gonna be 12 precinct.
Yeah. We want it.
So move.
Second.
Make that we won't wrap,
We won't wrap.
we won't wrap,
That.
yeah.
All in favor?
Aye.
So moved. 24, discuss an act of land
23.
agreement. I'm sorry. 23, discuss approval on bid on tax resale property for Trinity County Appraisal District.
She just got a shit on vote for you.
Maybe heard the call there.
This is where they sold the property, I make a motion, we approve it.
Second.
All in favor?
Aye.
What do you do? It's something.
Number 24, Mr. Tommy Parks, discuss an act of land agreement between Joliet Dean and Precinct.
What this is, Judge, is, we got some big chunks of concrete and stuff, and he don't want them more. And I went through a lot of my riprap through this flood and everything, and he's giving it to me. That's just getting me on the property to get it.
Little 355, all that stuff out there.
I make a motion to approve it.
I'll second that.
All in favor?
Aye.
We move.
Make a motion to adjourn.
All in favor? Aye.